Zanele Buthelezi says they were kept in the dark, basically, about where the patients were being transferred to. So they couldn't even tell if those NGOs, where those mental health care users were being taken to, were fit for the patient's needs. You recall that yesterday the inquest heard from some of the lawyers representing those NGOs who are expected to testify at a later stage that some patients should have never been brought to their facilities but should have been taken to hospitals instead.
The information in the list, the requirement of the category, where did that come from?
There was a list that was sent to the Department of Health which contained the mental state, and they will tick to say this one and this one and this one will be transferred on this particular day. Then at times we'll advise that this one is not suitable to be in an NGO.
Yes. And as regards the NGO to be discharged to, did Life Esidimeni have any decision in that?
No.
Was that decided by the Gauteng Department of Health?
That's correct.
Buthelezi also told the court that Waverley never received the list of NGOs that patients were to be transferred to despite asking for it.
In the absence of information about the admission criteria of the NGOs, who provided information about what those NGOs were capable of, or what type of users the NGOs were capable of taking in order for the assessment and selection to match?
It means it's a Gauteng because we never received that information at all.
And also denied that patients left the facilities without proper documentation.
Were any complaints received regarding insufficient medication or expired medication?
No report was ever received.
No record or no complaint was received?
No complaint was ever received.
Thank you. Were complaints received about patients who were dirty, malnourished, sick, unkempt, and without proper clothing?
No such report was received.
The inquest continues. Chris Alder Lewis, SABC News in Johannesburg.